Hello, welcome to a new video. In this video, we will study about the blood supply of the esophagus. So, the upper third of the esophagus is supplied by the inferior thyroid artery, the middle third by branches from the descending thoracic aorta, and the lower third by branches from the left gastric artery. The veins from the upper third drain into the inferior thyroid veins, from the middle third into the azygos veins, and from the lower third into the left gastric vein, a tributary of the portal vein. Lymph drainage of the esophagus. Lymph vessels from the upper third of the esophagus drain into the deep cervical nodes from the middle third into the superior and posterior mediastinal nodes, and from the lower third into nodes along the left gastric blood vessels and the celiac nodes. The esophagus is supplied by parasympathetic and sympathetic efferent and afferent fibers via the vagus and sympathetic trunks. In the lower part of its thoracic course, the esophagus is surrounded by the esophageal nerve plexus. So this is the blood supply. In the next part, we will study about esophageal constrictions. Esophagus has three anatomic and physiological constrictions. The first is where the pharynx joins the upper end. The second is where the aortic arc and the left bronchus cross its anterior surface. And the third occurs where the esophagus passes through the diaphragm into the stomach. These constrictions are of considerable clinical importance because they are sites where swallowed foreign bodies can lodge or through which it may be difficult to pass an esophagoscope because a slight delay in the passage of food or fluid occurs at these levels. Strictures develop here after the drinking of caustic fluids. Those constrictions are also the common sites of carcinoma of the esophagus. It is useful to remember that their respective distance from the upper incisor teeth are 6 in 15 cm, 10 inches 25 cm, and 16 inches 41 cm. Portal systematic venous anastomosis. At the lower third of the esophagus is an important portal systematic venous anastomosis. For other portal systematic anastomosis, see page 246. Here the esophageal tributaries of the azygos veins anastomose with the esophageal tributaries of the left gastric vein. Should the portal vein become obstructed, as for example in cirrhosis of the liver, portal hypertension develops resulting in the dilation and varicosity of the portal systematic anastomosis. Varicosed esophageal veins may rupture during the passage of food, causing hematemesis, which may be fatal. The lymph drainage of the lower third of the esophagus descends through the esophageal opening in the diaphragm and ends in the celiac nodes around the celiac artery. A malignant tumor of this area of the esophagus would therefore tend to spread below the diaphragm along this route. Consequently, surgical removal of the lesion would include not only the primary lesion but also the celiac lymph nodes and all regions that drain into these nodes, namely the stomach, the upper hall of the duodenum, the spleen, and the omenta. Restoration of continuity of the gut is accomplished by performing an esophagojejunostomy. So that's the video. Like and subscribe our channel.